Hi guys, it's Daniel McDonald here, sports physiotherapist and owner of Pottsville and Cabarita Physiotherapy. And today, this video is really for all of you out there that suffer with hip or knee osteoarthritis. And as we know, it's one of the most common ailments we see in our middle to later years. There's a lot of statistics that show that about 50% of people over 50-year-olds will have either hip or knee osteoarthritis. So this video really reaches out to a lot of people out there in the community. And the reason that I'm speaking to you today is that I've just come back from a new treatment technique for osteoarthritis of the hip. It's brand new in Australia. This treatment technique has been rolled out firstly in Denmark and then across Europe with quite remarkable success. And what I'm sharing with you today is basically the benefits of this new treatment approach and whether or not it may apply to you. So it's really, really exciting stuff, brand new to Australia, and I'm going to share it with you today. So basically, I just want to start off this video with just a little bit of a what is osteoarthritis, what are the current treatment techniques available at the moment, which are very commonly prescribed, but often they don't have a lot of evidence behind them. And then, as I said, I want to talk to you about this new groundbreaking technique that, as I said, has just arrived in Australia. So if we look at osteoarthritis, basically we know it is a degeneration or a wearing out of the articular cartilage. And articular cartilage is the cartilage that lines the surface of weight-bearing joints, and it basically provides shock absorption to the joint and also provides lubrication to the joint. Now, the key thing about articular cartilage is that it needs movement and it needs load to regenerate itself, okay? And when you take away movement and you take away loading, the cartilage starts to undergo a process of degeneration. And that, again, it really is a new thinking in the way that we approach osteoarthritis. So previously, with osteoarthritis, 5 years ago, we thought that people that had osteoarthritis should avoid loading, should not do weight-bearing activities because that's going to make the osteoarthritis worse. As I said, this new research coming out of Europe has shown that that's actually completely false, and the opposite is true, is that cartilage needs load and it needs movement to regenerate itself. If you don't load the cartilage and you don't move, the degeneration will accelerate, and you're actually accelerating the wear and tear of your joint. Now, I know there's a lot of you out there that will probably be saying, well, when I move, it hurts my knee or it hurts my hip. And that's correct. But what this new program does is it loads your joint in a very specific way and under a very specific dosage to just provide enough stimulation to the cartilage without overloading it. So it's a very, very fine line, but as I said, it is groundbreaking in the way that we now approach knee and hip osteoarthritis. So again, I'm going to talk about some of the treatment techniques that you may have already tried. Now there's things like non-steroidal anti-inflammatory drugs, Nurofen, ibuprofen, those sort of things. Again, there's very little evidence to suggest that they have any long-term benefit in treating osteoarthritis of the knee hip. And in fact, some of the other factors associated, the more systemic things associated with taking anti-inflammatories, means that they really shouldn't be prescribed in people with osteoarthritis. You may have heard of things like PRP injections, platelet-rich plasma, or stem cell injections. Very, very expensive things. Again, there's very little to no evidence that actually works. Knee braces, foot orthotics, knee arthroscopies even. Again, absolutely zero evidence to suggest that either of those things has any long-term benefit to people with knee or hip osteoarthritis. And as I said, this new program that has been rolled out in Europe called the GLA program, which we're being the first clinic to roll out in Australia, the average symptom reduction in people that went through this program with 32%. So people that did 8 weeks of the GLAD program had an average reduction of 32% in their pain. They had better quality of life scores, they took less painkillers, they had less time off work, they were happier, and amazingly, 70% of those people that completed this program either cancelled or delayed their knee or hip replacement, which is pretty amazing. So again, I'll reiterate that 70%, so 7 out of 10 people that did the GLAD program in Europe either cancelled their knee replacement or put their knee replacement on hold because they'd had such a significant reduction in their symptoms and they felt they were able to gain control of their arthritis themselves, that they didn't feel they needed to go down that avenue anymore. So as I said, this is a brand new treatment approach. It's brand new to Australia. We're the first clinic in the area to be rolling out this program. And what the program is basically it's a 6 to 8 week program of supervised exercise. And part of that supervised exercise is that you have a physiotherapist there monitoring exactly what you do. As I said, it's not just about doing any old exercise, because as I'm sure many of you have felt before, that when you do the wrong exercise or you do too much of it, your knee swells up, it starts hurting. So with our program, the GLAD program, there's a physiotherapist there prescribing you specific exercises under a specific dose, and they're correcting the way you move. And that way we know that the knee or hip is moving correctly. You're getting exactly the right amount of loading on that joint. The loading is getting distributed evenly through the joint surfaces. And as I said, the dose is very, very specific so that we know exactly how much load we want to put on that knee or hip. And as well as that, then we follow that up and we're able to then monitor that dose depending on how you pull up after that last session. And it's really important to realise that this program is not just for people that have minor osteoarthritis, it's for everyone. So even if you've been told you've got bone-on-bone osteoarthritis, this program is as effective for those of you as to those that, maybe you've just started, you might have had an x-ray and it's just shown a little bit of arthritis in the knee. So it's for absolutely everyone. It doesn't matter how fit you are or how unfit you are, it's suitable for everyone. So the idea of the program is that it's 6 to 8 weeks of supervised exercise in a group setting. You don't have to do that. We can give you the exercises and you can do that at home. There's no problem with that at all. As I said, and we can monitor how you're going, but by far the better results are obtained by having a physio there to really look at what you're doing. With the GLAD program as well, it includes 2 hour-long education sessions, and that really expands on what I'm talking about today, which is what is osteoarthritis, what are the symptoms of it, what are the treatments available for it, and most importantly, giving you guidelines in terms of how you can safely exercise and how you can safely do things in your life to get that exact amount of load on your knee or hip to stimulate cartilage growth without causing overload or degeneration. So for those of you that that want to get access to this new groundbreaking approach, I really advise you to call one of my friendly receptionists. The phone number is 02 776 6676 4000, and you can get more information by calling that number. We can also email you some information, and you can also, even if you want, just access the education sessions, no obligations at all, which are incredibly helpful. But as I said, very, very excited to be rolling out this new program. It's just available now in Australia, and as I said, imagine what your life would look like if you had 30% less pain in your knee or hip. You were able to move more, do more exercise, pick up the grandkids, do all those sort of things that you maybe have avoided or been too scared of doing. Imagine what that would be like if you had the confidence to be able to do that without pain or aggravation. So as I said, either call 02 6676 4000 or go to pottsvillephysio.com.au, and there's a part of our website there with information on the GLAD program. And if you have any other questions, please give us a call. Thank you.